Yes, yeah. Maisa, can you mute yourself, yeah, Maisa? Good. Please keep yourself muted during the lecture. If you have any questions, just raise your hand. I will get to you as soon as I can. Dr. Noha, can you follow that raising hand if you just alert me when you have somebody raise their hand?
Okay.
Inshallah. Alright, so أهلا بكم في أول محاضرة للديفرنشال diagnosis. I am honored to help in this regard. You have great instructors. Dr. Noha is leading the effort for differential diagnosis, and they will be the main source for you to ask questions in person and to interact with them during the lab time. My part of this course is the lecture time, and the lecture time is about an hour every week. And you have the schedule, and we'll follow the schedule as presented. Today is the introduction for the differential diagnosis itself and for the screening. Those who are not muted, لو مش muted, mute yourself. Mute yourself, please. I probably can mute everybody if you
I think it will be better, Dr. Hamid. هيبقى افضل لو حضرتك عملت ميوت للكل.
Can you do that from your side, because I don't see it. I'm looking for it for now. كل واحد mute himself for now, please. Mute yourself so you don't disturb the others. I can find Dr. Nova. If you can search for it or ask somebody to mute us, mute all of the.
I'm searching for it, but I didn't reach it yet.
Yeah, if you, I have not found it so far. Let me check that. You still see my screen, right? I'm gonna go from this one here so I can check it out. So far, I can find it. So we'll continue, inshallah. So we'll see how that will go. Everybody's muted. Can you hear me so far?
Hi, Dr. الصوت واضح.
Good. Asma Farag, mute yourself, please. So the differential diagnosis is a terminology that we use now in physical therapy, and it is very important topic for us to consider. And this is how we look at it. So let me share with you the objectives of this course, and also the objective of this lecture is to identify the key factors in the history of the patients that can tell us about signs and symptoms that may consider risk factors. يعني بنبص على signs والsymptoms ونقول ايه هي risk factors, ايه هي yellow flags, ايه هي red flags, and we'll decide according to that what we should do next. Should we refer this patient to another professional, medical professional, which include medical doctors, another physical therapist, will include other healthcare professionals, or we continue with some kind of caution while we're treating our patient. This conditions that we're referring to that needs you to know that the pain that we see for the patients when you evaluate patients For example, for shoulder pain or for hip pain or low back pain, this pain not necessarily coming from musculoskeletal reason, yeah, from bones, joints, ligaments, but might be coming from different areas of the body. And that's what we call the referral pattern. So for example, this picture in front of you, we may have liver or gallbladder pain presented at the right shoulder, in the back of the, like closer to the inferior angle of the scapula, and that is what we're looking for. We're gonna learn together and teach you, and I will be learning from you as well. I need to hear from you how you see that in your patients. My patients coming with the, for example, will tell you when I eat, I have increased pain. Mute yourself, please. Mute yourself. Amira, Judah,
ماما
mute
دنيا
yourself.
قالت لي ولا لا خلاص ما تجيبش احنا نروح نقرا ارقام دي. ماما دنيا قلت لك ربع ساعه وهتيجي.
يا ندى، ندى عصام، mute yourself وانت بتكلمي ماما. Thank you. All right. So we will apply this diagnostic clinical reasoning to the patient cases. So we're going to look at patients with the back problems. And when we do our evaluation to look at the range of motion, look muscle testing, we also will consider any visceral pain, any pain coming from the heart, from the lung, from the stomach, and that's the essence of this Can you hear me? Good.
كده اوكي يا دكتور حمدي، كده عملت ميت له كله.
تمام. Very good. شكرا جزيلا.
الو؟
انا معاك يا فندم.
عملت لهم كلهم ميوت كده، واضحه لحضرتك؟
واضحه نعم، بس سامعاني حضرتك؟
انا سامعه صوت حضرتك كويس قوي.
Very good. And you continue to recording, right?
Okay.
Good. So the objective of this course, as I mentioned, is to look at the various body part system that may refer pain to different areas of the body and can mimic the musculoskeletal or neuromuscular diseases. So if we have patients with the neck pain, with the shoulder pain, arm pain, we will not only look at the that part that we are evaluating, but we'll also look at other signs and symptoms coming from different parts of the body. And that needs you to be more, of course, educated in the internal organs, how it affects referral pattern, where it goes to. But most importantly, you need to be educated how to ask the question for the patient to detect that. So you need to ask questions to lead you to think about any of these organs and how to ask these questions. All right. So if I go next here, this semester we're going to use the textbook. The textbook is called Differential Diagnosis for Physical Therapists. We are working from the 5th edition. The 5th edition, there is a 6th edition out there, but will be working for the 5th edition. If I stop sharing here this one, and I'm gonna go to share again my library. This is the book. This will be the book. It's the digital copy for it, and the book has 3 sections. If you have the book, you will see that. So we'll have section 1, section 2, and section 3. We will address all section 1, including today, introduction to screening for referral. Next session will be about interviewing, a screening tool. So when you interview, you make you do that screening. So how we'll teach you what is the interview, what the questions, what is the follow-up questions, and how you ask these questions. And then in section 3, we're going to go a little bit in deep the types of pain, especially with viscerogenic. When I said viscerogenic, the pain is coming from your stomach, from your colon, from your ovaries, from the kidneys, from the heart, not necessarily from the bones, joints, and ligaments. So that's the pain types. We're going to discuss it, and we'll discuss the viscerogenic pain pattern. In the fourth chapter, we're going to look at the assessment as a screening tool. When you assess, how you detect red flags and yellow flags. In the section 2, we will not take all the chapters because of the time limitation. But we'll concentrate on 2 chapters. Will be chapter 9, screening for hepatic and biliary diseases, liver issues, and we will be screening for cancer. So the chapter 9 and chapter 13 will be discussed in this course. All other chapters, it is for you to increase your information. You should read all chapters so you can have more information in your bucket to help your patient. In the third chapter, we will address almost all of it. We're going to look at the screening of the head and neck, screening for the sacrum, sacroiliac, screening for lower quadrants, and screening for the chest and the upper quadrants as well. So this is the book that we're going to use, and these are the chapters that we'll be using. Let me go back to my lecture. And at this time, I'd like again to announce that please type your name in the chat. If you don't type your name, you will not be considered present in this lecture. اكتب اسمك في الشات علشان نعرف انك حضرت. لو ما كتبتش الاسم مش هنعرف انك من الحاضرين. اهلا وسهلا. طيب. So we talked about the book. Yeah, this is the ISBN number available to you if you like to order the book. There are some used book available in the net. If you order that, it might be a cheap price to have the book. For those who don't like the digital books and they need the books in their hands, it's available to you. Order that and use it. These are the chapters that will be included in this course, chapter 1 through 4, chapter 9 and 13 from section 2, and chapter 14, 15, 16, and 18 from section 3. And for now, I'm going to start very fast and to put some definitions of terms, terminology, so we understand all of us احنا بنتكلم على ايه بالظبط. أول حاجة differential. When we say differential, معناها we distinguish disease conditions from presenting similar symptoms and signs. يعني في مرض بيدي أعراض شبيهة جدا بمرض آخر. إزاي نفرق بين الاثنين؟ That's معناها differential. يعني اثنين من ال two from the diseases are similar in signs and symptoms لكن مش 100% similar of course. هتلاقي في اختلافات and we need to detect that. How is that differentiated? And that's the meaning of the word differential. I have low back pain. And low back pain معناها pain when I stand, pain when I sleep, range of motion restriction, but is that coming from my back or from my stomach? Stomach also may cause back pain that may increase by movement, by all of that. So we can differentiate which is which. That's differential. When I say diagnosis, معناها you identify the presence of a disease or a condition to be treated. So that's the diagnosis. The diagnosis of the physical therapist, for example, impairment of mobility, impairment of function. This is the physical therapy diagnosis that we need to determine. So we know now what's differential, we know what's diagnosis. Screening, the word screening is going to be used in this course a lot. We're going to screen. So screening معناها to identify a condition, whether that before symptoms develop or during the symptoms or after the symptoms, prognosis of it. So you're going to screen for For example, patients or a client, the difference between patient and the client, patient is already receiving physical therapy, client is a potential. It's not, don't have the disease, but you think that this client may have the disease in the future that have risk factors. So you identify that and you teach the patient to avoid, and that would be prevention programs. So the screening is you screen for conditions or signs and symptoms that is present at this time, or it may be coming in the future, prognosis. Like, for example, if you have a client talking to you, 35 or 40 years old female, she's not active, she has postural problems, and you is not under treatment with physical therapy yet, but you warn this patient, this client, you tell her if you don't do 1, 2, and 3, you may develop 1, 2, and 3. So you are educating the general public or those who are not really affected by a disease yet to avoid any kind of diseases. So that's what we looking for when we look at the screening tools, which is very important now in physical therapy. There are specific physical therapy clinics for prevention, not just for treatment, to prevent the things before it happens. All right, I'm going to go a little faster. So the purpose of this course has twofolds, mainly twofolds. One, to help you to recognize the area beyond your practice. We need to be very courageous, very honest when we see our patients. We say that when I see signs and symptoms that I cannot deal with, I will refer this patient to the specific medical professional that can deal with it. So that's part of the deal that we will look for. Like, for example, if a patient coming to you with the left shoulder pain, and you think that's coming from the heart, which most of us know that left shoulder pain may be coming from the heart, you need to have the ability and the skills to differentiate between true shoulder pain and pain referred from the heart. And if you think it is coming from the heart, it is your responsibility and your honesty to tell the patient, please go see your heart doctor, cardiologist immediately, because that might be a life-threatening condition that you're dealing with. تمام؟ يعني عايزين يبقى عندنا الشجاعة ان احنا نقول ان انا ما اقدرش اتعامل مع الحالة دي لانها ممكن تكون جاية من القلب وانت لازم تشوف الدكتور immediately. That's part of it. The second part of this course is to provide step-by-step method to identify clients' needs. So you will look at what question to ask, how to do the assessment, and then how you refer or how do you continue your treatment with this patient. There are some key factors here. We need to look at the side effect of the medications, the comorbidities, and the visceral pain mechanism. When I said side effect of the medications, you need to know what type of medication the patient is taking and how that will affect the condition and affect the physical therapy that you're going to get. The comorbidities, the other diseases that contribute to the condition or may result from the condition, and the visceral pain mechanism that we talked about it before. It might be coming from any other organs. The diagnostic model that we're going to use is to evaluate, to organize, and to determine. That means to evaluate information provided to you and then organize it in the way that you understand. Like, is that a syndrome? Is that a cluster? Is that a category of diseases? And then you determine the appropriate intervention according to your understanding and your knowledge. And with that, we're going to use this model. Like, we have like the diagnosis. You do first your examination before you reach to that. And then when you do the examination, you follow that with the evaluation. It's two different terminology, and they are completely different from each other. Like when you do your examination, for example, you do reflexes and you say that this is hyperreflexia or hyporeflexia. صحيح؟ لكن how to use this knowledge to make a judgment call. So the evaluation is a judgment call for you to say that that means what? If this patient has increased reflexes or muscle weakness, and that's not just a diagnosis. It is an it is an examination that can lead to a diagnosis, and your ability to develop evaluation statement, which is the judgment call for you as the therapist, will lead to a good diagnosis. I hope you are following with that. I may translate that in Arabic for your sake. فالاول بنعمل التست، الاول بنقيس الرينج اوف موشن، بنشوف المسل باور، بنشوف what the patient has. But this is not the evaluation. This is the examination. Evaluation is to put this together. تحط الحاجات دي مع بعضها، تقول لا العيان عنده ضعف في البايسبس وعنده hyperreflexia. Why is that so? For my evaluation may be what? That is the judgment call that you put together as a final diagnosis for you. You put the diagnosis and you look at the prognosis for it, and then we determine what is the intervention. And while we determine the intervention, لازم يكون عندنا idea what is the outcome. يعني هنوصل لإيه بالعيان ده. الاوتكم دي مهمة جدا في الفيزيكال ثيرابي، يعني مش عايزة ناخدها بسهولة، لأن الاوتكم دي it is a crucial step of when you start the treatment. You have to have an end in mind. يعني انا هبدا النهارده اكسرسايز بروجرام، انت عايز العيان ده يبقى ايه؟ عايزه يعمل ايه بعد 3 جلسات او 4 جلسات او 10 جلسات whatever you do. ايه النهايه بتاعته، هيوصل لايه؟ That's very important part اللي هي الاوتكم measures. All right. I put this slide and you have it in the book to see what's included in the diagnosis, in the prognosis, in the intervention, and the outcomes, and basically the things that I just explained. ايه هو الفرق بين examination and the evaluation? When you come to the diagnosis and you have the prognosis in mind, you put your intervention and you measure the outcome. So read that in details and refer to that. So عشان يبقى عندك الباك جراوند والبيس to build on it. I may help you some with that when you read. So I'll put some here few words about the examination. Examination is your initial comprehensive screening. That including what? Including your interview, including الأسئلة اللي بتسألها. System review. System review is a crucial part of the differential diagnosis. ومعناها انك تعمل سيستم ريفيو ان انت بتعمل تشيك على الفيتال ساينز، بتعمل تشيك على الهارت كونديشن، على الجي اي سيستم، وتعمل تشيك عليها whether that بالاسئله اللي بتسالها للعيان او your hand evaluation as well. We're gonna address some of these points while we going inshallah. So selecting and administering test and measurement is crucial. What test that to use and how you interpret the test results. It's not just to do the test, but how you read it, how you react to the results of this test. All right, that's the examination. And then the evaluation, as I mentioned, it is a judgment call for you as a clinician to put the things together. انت عارفه وانت عارف how to test the muscle testing, how to do the range of motion, how to do the reflexes, how to do the myotomes, dermatomes. But when you do that and you come up with the deficiency, for example, عيان بيقول لك انا عندي الحته دي فيها numbness and tingling، عنده weakness في extensors of the wrist, for example, and where to go next? What does that mean? خلاص that's the judgment call. معايا يا شباب؟ إن شاء الله. تمام. All right. So the diagnosis will include the outcome of evaluation and the examination. You're going to put the diagnosis after you put your statement, the evaluation. You organize the signs and symptoms, the syndromes, and then you start to think about the prognosis according to your ability. For example, disc lesion لسه حاصل النهارده، عيان جاله disc prolapse. How long it's gonna take to recover? How many days? How many weeks? And that will develop. You develop that according to your education that you're taking right now, according to your clinical expertise. كل ما تشوف عيانين اكتر كل ما تعرف امتى العيان ده بيتحسن. And according to your readings, when you read more, you understand exactly where we go. So, for example, there are some written statements about the disc lesion. It takes about 8 to 12 weeks to recover. So you negotiate that with your patients. You said that you just got the disc lesion right now, and that it may take up to 8 weeks to get you back to normal without pain or with the normal movement. You're able to go to work. All of that need to be negotiated with the patient, and that's called prognosis. Prognosis, and the prognosis also include the plan of care. What you're going to do as a physical therapist to help this patient, and how many times you're going to see it, and that what is your intervention strategy. هتعمل ايه ليها؟ تحط hot bags, هتدي exercise, هتدي manual therapy. All of that included in your prognosis and the patient education as well at the beginning. All right. And that's the prognosis that we just talked about. Please include with your prognosis the timing, because some patients may come in the morning will be better than the evening, for example. We need to pay attention to the time of the session itself and how it affects the patient's performance, and also the frequency. How many times do you like this patient to come, and what is the consideration of that in regard to transportation, availability of therapists to treat, and all, and the work, the patient's work. How many times they need to take off from work to come to you as a physical therapist. So that's all included within your prognosis. That you need to look at that comprehensively when you treat your patient, when you give them directions. Intervention, يا شباب, need to be thought carefully when we put a plan of care. What are the things that we need to include to help our patients? Is it just talking to the patient, which can be a great part, patient education, or skilled physical therapy interactions, like the manual therapy techniques, like the evidence-based electro, not just any electrotherapy, the evidence-based, or other types of interventions like neurodynamics, neurorehab. All of that need to be discussed greatly with the patient and said, this is what we're going to do, this is how much it costs you, and how many times you will see this patient. And then you apply the technique. When you apply it, don't just apply it and forget about the initial evaluation. You need to go back and re-examine and see what the performance and how we improve in the future. All right. I talked about the importance of the outcome. The outcomes are the impact of physical therapy intervention on the condition of the patients. مش بس على muscle power. You need to look at the impact of the intervention of physical therapy على pathology of the patient, psychology of the patient psychology is getting better, getting worse, and impairments على function disability. على risk reduction, like you engage with the patient to increase their physical activity, to reduce the risk of heart conditions or to reduce the risk of high blood pressure, for example. So that's your outcome. Your outcome is what you did as a physical therapist and to affect the patient's condition, whether that immediate muscle weakness, for example, and the muscle will be stronger and able to carry load, able to play with her children, able to lift something. That's the outcome measure. And also whether you prevent things from happening. معايا يا شباب؟ if I educate my patients that if you don't do range of motion for the cervical spine, you may develop cervicogenic headache. To avoid the headache, you need to do the exercise. So that's outcome measure that we prevented headache by applying therapeutic exercise program as a prevention tool, not as a treatment tool. So your plan will be uh, treatment and prevention at the same time. That's the plan of care. Now, when we come to the screening for red flags, and that will be a great part of your course this time, we'll give you case studies. And then from the case study, we'll say that identify red flag, identify yellow flag, identify risk factors, and the difference between the three of them. Like, for example, and they can be confusing, but I don't want you to be confused. Risk factors is always there. Like, for example, if I said age is a risk factor, age. So my age as like 65 or 60, I'm 63 now, 63 years old male, that you said that's risk factor. But what was that risk factor? Should I go yani, and stop working? No, it's a risk factor for diseases that we need to look for and to identify. Like, for example, if I'm coming to you with 65 years old male and coming to you with low back pain, you need to look at the condition. Have I screened my prostate? Is there any colon cancer? That's a risk factor for other diseases. So you need to consider that. But if the other diseases are not there, so the age will not be a risk factor. This risk factor can turn to be a yellow flag. A yellow flag. For example, if I am 65 years old and I have maybe a kind of urine not controlled 100%, maybe I pass a drop of urine every now and then, and but not consistent, and that may be considered the yellow flag at the beginning to make sure that it is not a serious issue. But if it is consistent, like incontinence of the urine, not able to control the urine, that will change to a red flag. So that the point here I need to make, it might be a risk factor, can turn to be a yellow flag, can turn to be a red flag in the same patient. So you need to be careful identifying what are the red flags, what are the yellow flags, and what are the risk factor, and what we do with them as physical therapists. Tamam? This is the screening tools. And why do we need to the screening now, especially nowadays, more than ever? That we have physical therapy now. Physical therapists are seeing patients for the first time, not before the doctors seeing them. I know that practice of physical therapy in Egypt, you have to have a referral to see the patient. But this not the condition in across the world. You may be working in another country or so, or you may change the practice law in Egypt soon. Maybe I heard that there are some directions toward that. So, for example, in the United States, we have the ability to see the patients before you don't have to see the doctor first to see you for leg pain or for back pain or for neck pain. They come to you, and if you see that this patient need the doctor referral, you refer. So that's it's called direct access. So direct access is part of our physical therapy practice, and that's why we need to do screening very well to be very well versed. يعني to be يعني لازم تكون كويس في المعلومات بتاعتك. ايه السبب البين ده وجاي from where. It might be from the stomach, it might be from the colon cancer, might be from the ovarian cancer. So that will be the direct access is very important for physical therapy to be highly educated in this course, differential diagnosis. طيب I'm trying just to introduce that course to you, so تحب الكورس الأول وتحب المعلومات اللي فيه وبعدين apply it together. It's very interesting course. I love teaching the differential diagnosis, and I want you also to love learning about it, because that will help each other to reach our goal. nowadays يا أحباب المستشفيات غالية جدا، سواء هنا أو في مصر أو في أي مكان. So the in and out is very fast. يعني عيان هيعمل مثلا knee replacement. In the United States now there is it's called the critical path. كريتيكال باث يعني العيان يخش الصبح ويكون عامل التحليلات قبلها بيوم، ويخش ما يقعدش الا يوم او يومين في المستشفى، مع انه مغير الركبه كامله او الهيب كله كويس، يعني توتال ريبليسمنت اوف ا جوينت، ما يقعدش في المستشفى الا يوم او يومين. And that's a quicker turnout of the patient. The patients may get sicker, and you are the only one follow up with this patient. انت عايز توقف العيان وتمشيه وتحركه، ف you see this patient a lot. So, and that's why you need to be very well versed of the differential diagnosis. If this patient, something happened while you're treating this patient, you need to identify what's going on and why this patient is not progressing. Right? So these are the importance of screening and importance of knowing المعلومات of that. I will give you
Excuse me.
Yes, ma'am.
Doctor, excuse me. We have question here. Mariam, she don't get the meaning of the yellow flags.
Mariam. So the yellow flags, I will come in details, Doctora, in the future for the identify risk factor, yellow flag, and the red flags. But for now, risk factors is always present, and that's present in many patients, regardless if they have the disease or not. Like, زي for example, male or female can be a risk factor. تمام؟ اليلو فلاج you need to proceed with physical therapy. يعني لما تيجي تعمل physical therapy you're gonna proceed with it but with very like caution. You'll be very protective when you do the physical therapy. I'll give an example. Patients has groin pain, عنده groin pain in the groin في الحته بتاعت الانجوينال hernia كويس، بس ما عندوش الهرنيا. انت identify that it might be a yellow flag لانه البين right in the groin لغايه ما تشوف ايه الريزن بتاعه. It might be hernia just started. فلما تيجي تدي الاكسرسايزز ما تديش strenuous exercises may increase the hernia. So yellow flag is to proceed with physical therapy لكن تبقى very protective, very cautious when you do it. In red flags you don't do the physical therapy, you have to refer to the doctor.
اليلو فلاج ممكن اعمل
يعني لو عارف ان العيان ده عنده heart condition you need to refer to the heart condition. انا شفت hand raised يا دكتوره مريم something.
هي مريم يا دكتور، ده السؤال بتاع مريم اللي عامله هاند ريز.
تمام. alright جزاك الله خير. طيب before I go to the case example, any other questions? Any other questions from the audience? We have good numbers on the call, mashallah. Any other questions?
مريم you got the point?
نعم.
مريم لو عندها سؤال تاني. Yes يا دكتور. اوكي خلاص.
تمام. Good. الحمدلله. All right, so the case example that I will give is just an example, and your great instructors, professors, and at Badr University will continue explain that in details with you in the sections, and they will answer your questions as well. Let me introduce that. Mariam raised her hand again. Is that she needs to say something?
No, it is the same.
Okay. All right. So the case example that I will introduce you today is the case of 60 years old man retired from his job. يعني واحد عنده 60 سنة وطلع على المعاش. هو كان president of large vocational technical college. كان هو الرئيس بتاع مدارس مهنية زي اللي هي vocational schools. And the second day of his retirement أول ما طلع على المعاش كلم الدكتور بتاعه قال له أنا عايز أروح للعلاج الطبيعي لأن أنا حسيت إن أنا عملت improvement بالعلاج الطبيعي قبل كده. فالدكتور قام كاتب له يتحول للعلاج الطبيعي من غير ما يشوف العيان ده. يعني حوله على العلاج الطبيعي من غير ما يشوفه بالتليفون وخلاص وحوله. ودي واحده من الحاجات اللي بنشوفها كتير. يعني الدكتور يحول من غير ما يشوف العيان، يقول له انت عندك لو باك بين، روح للعلاج الطبيعي، ما يكشفش عليه الكشف التمام يعني. لما تقرا العيان ده هتلاقي عنده غير عمل هيب ريبليسمنت، وعمل different types of hip replacement changes. How many years between that? I need you to read this case. I have it here on the slides, and you have it in the book as well. I need to just get to the point. What I looked at in this patient. يعني عيان اتحول ليك من غير examination of the physician. Based on previous rehabilitation. يعني هو خد علاج طبيعي قبل كده واتحسن، فقال تمام انا هتحسن تاني واخد العلاج الطبيعي. هو السوشيال هيستوري بتاعه ان هو يعني just got out of work، يعني خد له يعني طلع على المعاش وهو married وعنده 3 grown children. لما تبص للباست ميديكال هيستوري بتاعه عنده 3 total hip replacement، عنده open heart surgery 10 years ago، عنده congestive heart failure 3 years ago، وبياخد medications من ضمنها اللوتنسنز، البيبي اسبرين and the Zocor. Let me stop here for a minute and I can write that to you here. I will write it here and then I remove it, but انت take note of that. لما تلاقي عندك medications وانت مش عارف ايه هو الميديكيشن، you may go to drugs.com and search for it. يعني لو www.drugs.com and type the name of the medication and see what is it. Like for example, if I don't know what's the Zocor at 20 milligram, why this patient's taking it, let me do this exercise with you. I'll stop here for a second. We still have time. So I'll stop here for a second, stop sharing that one, and I will share with you again my screen for let me get here is Google. Yeah, let me share that. So if I go here and type www.drugs.com, and right here's my, do you see my screen? Everybody, you see my screen?
Yes, doctor.
Good. So I'm looking at the drugs.com and I'm gonna type the Zocor, because I don't know it. So I will check for the Zocor effect and I look at why this Zocor is taking it. So this Zocor is taken like it's called the other namely statins, is located, is used for low blood pressure, used to lower the blood pressure, and with the bad cholesterol. So واخدين يعني anti cholesterol, high level cholesterol. And when I'm here, I need to look at the side effects of that drugs because I'm treating patients with that. And if you look at that side effects, patient may have dizziness, fainting, may have joint pain. See that? That's all the side medication, the side effect of the medications. And you need to be well versed as a therapist of why this patient is taking this medications. So this is just an example of the importance of the medications and how it can be the medication, can be risk factor, can be yellow flag. Like for example, patients taking this type of medication for extended period of time, I will consider that a risk factor or a yellow flag till I see and examine the patient for other reasons. I'll stop sharing, go back to my lecture here. Where is my lectures? Right there, okay. Okay, here is the lecture right there. You see the lecture? Yes?
Yeah.
Yes, doctor.
Good. So with the going back to the same patients, العيان عنده 3 hip replacement، عنده cardiac issues، عنده heart failure or heart congestion, and all of that uh, can cause problems of and the patient is telling the doctor that I need more physical therapy, and the doctor send him to the physical therapy. So you need to be careful evaluating this patient, identifying the red flags and the yellow flags, and then you come up with the with your plan of care. This is another things that this slide has so many things that this patient has, the clinical presentation of this patient, and how can we look at it. When we take the vital signs, and I will urge you to take the vital signs for every patient that you see. It is his blood pressure, 92/58. I want you to think about, is that normal or abnormal? Is that from sitting different than from standing or from lying down? Uh, Please write these questions because we're going to follow up with that and identify red, yellow, and risk factor accordingly. The respiration, is that normal, 22, or that abnormal? The pulse oximeters, the oxygen level, 89%, is that normal or decreased? And the 97 temperature Fahrenheit, so that would be like 34 or so Celsius. Is that normal or abnormal? Okay, so that's what I need you to think about, the clinical presentation of the patient and how you determine. In this part, we're going to look at the medical condition can cause pain, dysfunction in the neck, in the back, in the shoulder, in the chest, and this patient may have all of that. We may have pain may be coming to you with the sacroiliac pain or hip pain because of the previous surgery. And you need to identify, is it because of the previous surgery? Is it because of the cardiac issues? Is it because of the other issues that this patient may have? Right? So this course is not to confuse you, but is to open your horizon. You think about other issues, not just a very specific issue in that joint. And I know that some of the students feel frustrated when we look at so many things and we are not giving you that this answer because we may not have the answer. We need to look at other questions, interview the patient, talk to the patient. And I have recorded some patient interview for you. We will share that with you during the course and to identify red flags and yellow flags from these recordings. All right. Now we come to the clinical decision-making process. I still have about 10 minutes and then finish with that. And within the 10 minutes, I will finish, inshallah. So when we take the clinical decision-making process, you already did the examination, the evaluation, you looked at the diagnosis, and you put maybe a primary diagnosis, and we have an idea about the prognosis, what should we do with this patient? So your clinical decision-making may be one of those. One is to refer the patients completely to another PT, to another healthcare professionals. And that's an important point. If we said to another PT, we need to also to be more professional in this area. I know that sometimes you said if I refer to another PT يبقى يعني بتدي الشغل بتاعك لحد غيرك يعني مش كل واحد هيقدر يعمل كل حاجه. يعني I am, for example, myself, I deal with spine patients. أي مشكلة في الظهر في السباين. لو عندي عيان جالي ب vestibular problems, neuro, I said, I'm not a neurotherapist, I cannot see you. So we'll have to refer to another therapist. So that's the referral pattern. We need to make sure to refer to the appropriate medical professionals or to the psychologist. If you think that this pain is more of a psychological predicament, that there's some psychological background for this case, you need to consult with the psychologist. All right, so this is the first thing, or you co-manage يعني تكونتينيو العلاج بتاعك ومع في نفس الوقت الدكتور بيشوف العيان ويكوميونيكيت يبقى co-management of the patient, which is that most of the time need to happen, or you just for consultation you send the patient to consult and come back to you. You take the decision. So it's completely different practice when you practice in a team. We should practice as a medical team, not مين أعلى من مين. المشكلة أحيانا في بلدنا الجميلة وفي بلاد تانية كتير في العالم إنه لازم نحط رانكس. الدكتور الميديكال دكتور أعلى من الفيزيكال ثيرابيست، أو ده أعلى من ده، أو نقل من قدر الممرضة مثلا النيرس. And that's has been changed in the world يا شباب. And I need you as a younger generation to get used to that. All of us are part of the medical team, and you need, when you sit on the table, don't feel under or أقل من الدكتور اللي قاعد جنبك. الدكتور has some information that we need, and you have a lot of information that he needs as well, or she needs. So we need to be part of the medical team. We think together and we get our collaborative or cooperative decision مع بعض for the sake of the patient. احنا كلنا المفروض نبقى باصين للايه؟ للعيان، العيان عايز ايه؟ فpart of the medical team. This is the clinical decision making process that we need to train ourselves. What should we do? To refer, to co-manage. Co-manage and to work together with other doctors to help the patient, to consult with somebody else, to retain. Retention is mean to, I don't need to refer this patient, and I don't need to co-manage with somebody else. I'm able to provide the care that this patient needs. And that's a good decision to do, not necessarily for every patient. Some patients will need other help, not just your help. You need some others to help them. So that's what we need to look at and to continue the clinical decision-making process. With that, I need to get to you some information about the guide to physical therapy practice. There is a book available now in the internet. You can look at it. Here is the link. You can just search for that. It's a guide to physical therapy practice that includes all the description of physical therapy, what is physical therapy, what to do for other cases, have the measurement concepts, and have also assessing risk factors. We talked about the risk factors, and this book has great information how to assess the risk factors. We will use a lot of them, a lot of this terminology and descriptions in this course as well. One of the things that assessing the risk factors when like the clinical presentation of the patient presents with mid-upper back pain, like in this area right here, and pain in the right side, like close to the inferior angle of the scapula, and you think that is a thoracic pain coming from the thoracic spine. And you attended the course with Dr. Radwan, عملنا manipulation and mobilization to the thoracic spine, and we kept on doing that. Patient is not improving. That's it might be a risk factor. It can be also a red flag if you identify that this is a liver condition, for example. So I will look at the age, I will look at the sex or the gender, I will look at the weight of the patient, excuse me, and that might lead me to think that this patient has something else. Like, for example, it's 1F, 2F, 3F, 5Fs here, 5F, fat, like the patient is a little bit overweight, fair skin, like white color, is not dark color skin of the patient. She, not he, female, 40, she is 40 or older, and there is a history of flatulent يعني بيخرج gas كتير, gas. So if the patient is coming to you with mid-thoracic pain and has all these 5Fs, we may think about the gallbladder issues. Is not the thoracic issues, it's a gallbladder, and it needs to refer this patient to a specialist, and the hepatologist will dealing with the liver. So this is part of our education, is to identify and refer according to the patient's condition. Should I stop here, doctor, and get any questions? any questions that we have? Anybody has any questions? I'm going to look at the chat for a second. If you send the chat questions, I will look at it.
Nothing in the
Please let me know.
No questions in the chat, yeah, doctor. No questions in the chat.
Good. Anybody has any questions? If you raise your hand, we can unmute you and you can ask your questions. Sarah Muhammad raised her hand, all right. Can you unmute Sarah يا دكتور؟
دكتور لو سمحت، هو بالنسبة للكيس اللي احنا حضرتك شرحتها، الميديكيشن هنعتبرها ان هي ريسك فاكتور، ولكن لو كانت الميديكيشن دي كانت السبب في انه يجيله الهيب بين او الجورن بين، ده كده هتبقى كونسيدر ريد فلاج ولا يلو فلاج؟
So medication is a risk factor because of the joint pain, right? So I'm going to follow up the joint pain then, evaluate the joint itself and see if that joint is really inflamed, swollen, have other problems, ولا دي جاية بس من الميديكيشن. Or how long the medication is taken. So your evaluation will determine, your examination will determine is that a yellow flag or a risk factors بس. لو ريسك فاكتورز هنعلم العيان نقول له يعني الميديكيشنز اللي بتاخدها دي الوقت طويل ممكن تزود الجوينت بين، فريكونسيدر جو تو ذا دكتور سي if that medication can be changed معايا. لكن لو الميديكيشن دي اوريدي سببت other issues in the joint and the joint is affected, we may consider that a yellow flag. So move slowly with this patient and not to force the treatment as we go normally. It may also a red flag. For example, if the medication causing osteoporosis of the joint, of the bones, and if you do exercises, you may break the joint, break the bones. صح؟ So لو ده حصل يبقى ده it's a red flag. I should be very concerned about the condition of the bone osteoporosis at this time. And the reason for that, what should I do with that? If it is only risk factors, it will be patient education, go check with the doctor, change medications. This is part. If it's a yellow flag, again, I'm going to continue with physical therapy, but I'll be very protective, very careful, not to force the patient to do extra unless we clear that yellow flag from the doctor. The third option is that تحول red flag and I may break the bones if I do exercises, so I need to go back to the doctor immediately before I start my physical therapy. Is that clear, sir? That was great questions. Thank you for it. Good. All right. So to conclude for today, understanding the risk factors is very crucial. It makes you a better the therapist to understand it and also to ask the appropriate question for the patient. يعني لو انت عارف ان الميديكيشن ده هو الميبي سبب، انت عرفت دلوقتي about الزوكور اللي هو بياخده عشان الكوليسترول، لو سالت العيان بتاخده قد ايه، كم سنه بتاخده كل ده، يبقى انت ايه اتعلمتي اكتر وتعودتي انك تسالي العيان، وده يبقى preventive education، يعني تقدري تمنعي حاجه هتحصل in the future by just educating the patients about that risk factors. طبعا risk factors مش بس الميديكيشن يا ساره، في حاجات تانية risk factors كتيره عايزين نعلم العيان عليها. part of it مثلا lack of physical activity، العيان لما بيمشي ولا بيتحرك وقاعد في الشغل 8 ساعات 10 ساعات وبتاخد ستيرويد او انتي انفلاماتوري drugs, that can be a huge risk factor in the future, can cause many problems. So you are part of this educational process for your patient. The other participants raising their hands.
أيوة.
خلاص طيب two more slides and then I'll get your questions. I talked extensively about red flags, yellow flags, and the risk factors, and also the mechanism of injury, the dysfunction. All of that need to be considered علشان قبل ما تحول العيان للدكتور تبقى عارف بتحول العيان ده لايه. تمام، مش هنقول ده ريسك فاكتورز او يلو فلاج او ريد فلاج وبعدين ما نحولش، او لما تحوله للدكتور تبعته بس وخلاص روح للدكتور. لما نبعت العيان للدكتور عايزه تبعتيه لايه؟ ايه اللي عنده؟ ايه what is the concern that you have? Like, for example, if I refer this patient back to the doctor, I will start, dear Dr. Muhammad, for example, or Dr. Ali, I have examined this patient today, and I noticed that he's taking Zocor for an extended period of time, for a year or two. And my understanding that this type of medication may increase joint pain, which the patient has right now, and it may be not because of the joint condition, and maybe because of the medication that this patient taken. Please evaluate and advise. So that you are respecting the doctor opinion, but you're giving them what to look for. مش تبعته للدكتور وخلاص. بدل ما نبعته للدكتور وبعدين يقول لك لا روح اعمل علاج طبيعي، الاخصائي ده ما بيفهمش، روح عند حد غيره. مش عايزين كده، احنا عايزين لما ابعتها بروفيشنال، وابعت very good directions. What are we looking for and how can we do that? الاساتذه عندكم هيشتغلوا معاكم في الريفيرال. How to write a referral, what things to say and what not to say. That's very crucial. تمام. وبرضه احنا بنبعت الريفيرال مش عايز تتدخل في شغل الاخرين. يعني ما تعملش ميديكال دايجنوسيس وانت بعت للدكتور انت عايز تعرف ايه اللي بيجرى. تمام. ما بعتش اقول له العيان ده عنده كونجستيف هارت فيلير، انت ايه اللي عرفك ان عنده كونجستيف هارت فيلير؟ الا اذا كان مكتوب. ممكن يكون مكتوب في الهيستوري بتاعه من دكتور تاني، اقول له this patient is noted to be diagnosed in سنه كذا بالدكتور كذا ان عنده congestive heart failure, and I noticed as a result has كذا وكذا وكذا. Please re-examine and consult, or re-examine and advise. So that's the referral that we send to the doctor. Has to be identified why you sending this patient to the doctor and what are the areas of concern. يعني ايه اللي انت concerned you to think that to send that to the doctor. تمام. And keep in mind that the referral to physical therapy also can happen. يعني المفروض لو احنا في good تعاون بيننا وبين الدكاتره، الدكتور برضه يبعت لك العيان علشان to rule in or rule out other causes. يعني بيجي لي عيانين كتير من الدكتور يقول لي for example we need to rule out SI involvement sacroiliac, or we need to rule out T4 syndrome. T4 syndrome is a syndrome that I can rule out by applying manual therapy mobilization. So that's it needs to be back and forth. يعني انت بتبعت للدكتور والدكتور بيبعت لك عشان to confirm the diagnosis. All right. I think this is my last slide, and I will also give you a chance to ask more questions. If I didn't answer the questions today, I have an email from BUC, so you can have email me at hamdi.radwan@buc.edu.eg, and I'll be happy to answer questions. Please make your instructors at BUC your first contact. They can answer you better than me, and they can get you the information or communicate with me to get you the answer as well. أهلا بكم جميعا. I'm happy to be with you again. And now it's your time for questions. Bismillah. Any questions? Okay. So in the chat, yes ma'am.
دكتور، هو احنا هنذاكر من التكست بوك صح؟ يعني لما نيجي نذاكر مثلا الداتا وكده تبقى من التكست بوك ولا من الباوربوينت؟
مين اللي بيسأل الدكتورة نهى؟
لا يا دكتور مش انا، طالب وحد من الطلبة. مريم اللي بتسأل.
مريم. So a textbook is essential that to read it. You have the textbook and you need to read a chapter. So we finished chapter 1 today. You should read the chapter, see what if you have other areas. لما بنيجي نشرح ما بنشرحش كل كلمة فيه. You need to read the chapter very nicely, very carefully, and highlight things that you need to ask about it. So yes, we have to refer to the textbook. Yes, ma'am.
تمام، شكرا يا دكتور.
عفوا. If you didn't write your name in the chat, please do it, because I'm gonna save it right now and send it for attendance. The attendance has to be by writing your name in the chat. أحمد عاشور بيسأل إيه هي ال outcomes. Yeah, the great questions. يا أحمد, ال outcomes is the tool that you measure the end of your treatment. يعني بعد ما بتعمل العلاج إيه ال results بتاعته. Like for example, it can consider the لو تعرف ال evaluation of the shoulder for example, include questionnaire اسمه ال quick dash. الكويك داش ده بيعمل لنا idea الفانكشنال capacity of the shoulder at the beginning of your treatment. يعني how much function that the shoulder has at the beginning of your treatment. وبعدين تعمله at the end of treatment to see how that patient improved or not improved. That's the outcome. The outcome measures is to measure your intervention as a physical therapy was effective or not effective or has no effect at all. So that's the outcome measures. Briefly, we can introduce some other outcome measures while we're going, inshallah. Did that answer the question, yeah, Ahmed? Ahmed, questions? Yes or no? Good. Anybody else? Any other questions? All right, Dr. Lohal, I don't want to increase the timing. I'm gonna save the chat. Those who have not put their name, they will not be included. And that is now saved. Please don't disconnect for now. Let me just save it. Yeah, all right. Save chat. Everybody else, you can, if you write your name, you can sign off, and I will just save the chat and send it as your attendance. All right, it's saved, يا دكتورة. I'll send that to you, inshallah. شكرا جزيلا. السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
We'll see you next session, inshallah.
إن شاء الله.
Before I leave, Sarah still raising her hand. Do you have other questions, Sarah? Sarah Muhammad Ali? Sarah Muhammad Ali, you can unmute yourself if you have other questions. I'll be happy to answer.
لا يا دكتور تمام، شكرا.
شكرا جزيلا. All right, السلام عليكم.
وعليكم السلام. Thank you, Dr. Hamid.
شكرا.